Good afternoon, everyone. I know it's too late, but I didn't have another choice. Let me go directly to our next lecture. Uh, it will be lecture number one, part two. I will talk about terminology and modeling and some important information about false and negative, positive and negative false diagnosis. And let me go directly to content. Here, measurement kinds. We'll talk about some kind of measurements, the difference between the heart rate and when your kidney disappear or send some bad thing to out of your body. Uh, to all of these, we are using another measurement tool. Accuracy and precision, it's important. We will study all of these and we will know what is the difference between them. And like I said, at last, the false and positive and negative false diagnosis. At first, let me take a general idea about these tools, these measurements. One of the main characteristics of the science is its ability to measure quantities of interest. Any science focus on a specific spot can develop more if we can develop better measurement tool or way. For example, common measurements used in a practice of medicine bodies such as temperature, weight, heart rate, and other. All of these pictures to illustrate these different measurement tool we are need to measure the weight, uh, heart rate, the temperature of this ill child, the heart rate. Here we are using X-ray to know a specific problem about some tooth. Here, at last, this is the note, the growth of science, like I said before, is closely related to the growth of the ability to measure. Here it's important, the measurement kinds. These are two kinds. The first one is repetitive. That's mean I will measure specific thing, but with many number at specific time. For example, your heart rate at normal, it's almost be 70 to each minutes. Okay, that means repetitive. And the health rate is about 15 times to each minute, to each 60 seconds. And the other one is the non-repetitive. For example, how your kidney can remove a foreign substance from your blood. That means here we have two kinds, repetitive and non-repetitive. And we are I give two specific example to all of these. Now let's talk about the accuracy and precision. In the lab, I say some information about them. About if I give you something, its weight, for example, 2 or 300 grams. When you calculate it, to be your result is acceptable must be approximately 300 grams. That means near from the right result, closely as can as possible. Okay, no way to accept result like it's 1,000 gram. Okay, or it's 100 gram. Must your result to be acceptable must be close as can as possible from the right number. Okay, when you ask some doctor to determine to calculate the temperature to a ill person, we know if he has some problem, that's mean his temperature will be more than 37, a little bit, okay? When he calculated, no one to accept result like its her or his temperature is 47, okay? That means he is dead. Must your result be has accuracy and precision. must be yes, measurable, to be reliable, to can accept it. Okay. Accuracy, let's give a appropriate definition to it. It refers to how close a given measurement is to an accepted standard and how it matched the true value. It's important. It must be close as can possible to the true value to be acceptable. For example, when we measure something and it was, like I said before, 2.9 kilogram, but noun weight is 9 gram, it's not acceptable. It's not, that means it's not accuracy. The advantage of accuracy is actually the accuracy and precision have the same goal, sorry. All of these goal are to minimize as can possible, minimize the mistakes, okay? To create reliable results, scientific, by minimize errors. Here, now accuracy is done. Let's talk about precision, and after that, we will do a simple comparison between them. Precision, it is a closeness of two or more. Here's different. When I talked about one fact about this weight, my phone weight, I said it's, for example, 300 gram. Not some different weight with different time, okay? At precision, I was talking about a one true result, one fact result. Here, the situation is different. It's closeness of two or more measurements to each other. For example, I asked it from a doctor in my team to measure the temperature to a eel in the hospital, okay? To an to anyone, okay, to ill, to sick, he or she is doesn't matter. When this doctor don't has enough experience to can measure the fact temperature number, that's mean to be reliable. For example, if he ill, that's mean his temperature will be more than the normal number. That's mean more than 37 little bit. Or let's say for the like this example below, 36. I said, okay. That's mean some increasing will be, but not too much to be reliable. Uh, this doctor taked the measurement tool and went to this ill person to measure its hair or his temperature. It will take at first, it will say, for example, 36 or 36.2. And I'm not sure about his measurement. That's mean what I will do. I will ask him to do this measurement to many times, for example, to 4 times. Here, to be this precision, here, to make my measurements be reliable, that means all these four numbers must be near from each other. Like the example below, 36, 36.2, 36.1, 0.4, just 36 again. That means my results are reliable. It have all of these numbers have the precision. My result is reliable. And I will do another thing to minimize more, to decrease the mistakes, to decrease the mistakes more, okay? But when the physician or doctor said his temperature is 25, that means it's not reliable. It's not acceptable measurement, okay? not acceptable number, not acceptable temperature to any human, because sure you have a background about the normal temperature to any human, like the heart rate to any human. At normal 70 to each minute, maybe be less than to any athlete, more than if he has some problem, health problem, psychology problem, I don't know, but will be close from this number, from 70. Here, to decrease the mistakes more, I will use the average way. That's mean if the physician take the yield temperature 4 times, that's mean I will collect all these four measurements, oh sorry, all of these numbers, and divide it on the number. That's mean يا مشكلة الكهرباء Okay, let me keep going. I will calculate all of these three or four temperature number and divide it on its number. That's mean divided on 4. If I have 3 temperature yields, that's mean it will be calculate. Uh, I will collect all of them and divide it on 3. By that, I can minimize the mistakes more. Note both the accuracy and precision have the same goal, like I said before, to make the measurements result more close, acceptable, and true. That's its goal. Unfortunately, let's talk about at another situation. Here, when I sent him to take a temperature to an ill person, something maybe happen, not because the physician experience or the measurement tool, but in some time I will have another problem. Unfortunately, some errors may be happen. For example, the blood pressure measurements. In some situation, for example, if this person very shy, when a beautiful woman, physician woman, maybe come to him to measure his temperature, her temperature, some different situation maybe happen because her uh, heart rate maybe will accelerate it more. That's mean we will have wrong measurement number. Let's say because overthinking, maybe he is shy person, maybe from scaring, you know, most of the ill number, ill numbers, because scaring or think bad before the surgery, her or his heart rate will increase more. The measurements device, maybe it's not good enough, or the physician experience is not good enough, and another. Here, let's talk about the difference between them. Like I said before, the accuracy refers to how close a given measurement is to an accepted standard and how it's closely it matched the true value. And the most important thing, let me say, it's a one fact result. For example, when measure something and it was 2 kilogram, but noun weight is 6.5. In your opinion, it's acceptable or not? Sure, not. Precision here, it's dealing with more than one result. It's closeness of two or more measurements to each other. For example, the ill person has an ill person has temperature is measured to 5 times, and we calculate all of these 5 times and divide it on 5 to can minimize the mistake as possible. Must the all measured be close from each other to be acceptable? Like I said before, here let's talk about the diagnosis of the physician. What must do the physician to decide the patient is ill or not? Sure, we'll talk about the medical history. He or she did a surgery before, and sensitivity to any medicine, and many things like that. The findings of the physician examination, if he did or have to do some exercises because some reason, the results of clinical laboratory measurements. I'm talking about the pathological test from lab, for example, blood test, or when the physician or the doctor is not sure about her or his case, sometimes wrong diagnoses are made. It's normal in all our world, not just in our country. Their name is false positive and negative and false negative diagnosis. Let's talk about what there are. The false positive, let me check the recording. I think everything is okay. I hope. False positive is an error, of course, when a patient is diagnosed. That's mean the doctor or physician said you has a disease, but actually you don't have. This means when a patient is diagnosed to have a practical disease when he or she doesn't have. It seems to be it's good, but actually is not because the ill person, by thinking he has this disease, he will deal according to that. That's mean, for example, a young woman was through to have a rheumatic heart condition and spent several years taking the necessary medicine to be better, complete bed rest before it was discovered that's a false positive diagnosis. That's mean she had been made. She or he really had arthritis. That's mean she had been made this disease. That's mean this disease is fact now on. And at the same time, she used not necessary medicine to few years. All of these have a side effect. The result is this case now really had arthritis. The second and last kind of diagnosis, false diagnosis, is the negative false diagnosis, is an error, of course, when a patient is diagnosed to be free or of a particular disease when she or he does have it. It's a disaster because many cancer patients uh, lost their lives because a mistake like that, because actually when she or he has a simple tumor and she went to a doctor, to physician to check it, to check up, and this physician said you don't have, you're not suffering from anything like that. By some time, not very long, this disease will be strong and strong. This by that them opportunity to survive is decreasing. For example, in the early stage of many types of cancer, it is easy to make a false negative diagnostic error because the tumor is small. By that, like I said before, a false negative diagnosis can greatly reduce the patient's chance of survival. Here, at last, the diagnostic error, negative or positive, can have a great impact on the patient's life. All of these has a bad uh, side effect on the patient's life. Here, what is the difference between them? Like I said before, it's an error, of course, when a patient is diagnosed to have practical disease when he or she doesn't have it. And at false negative, she or he has it, but the physician is diagnosed her to be free. All of these have uh, a great side effect on their lives. And all of these wrong or false diagnosed uh, is decreasing the chance ratio about these patients. In the early stage of many types of cancer, it is easy to make a false negative diagnosed error because the tumor is too small. Here, how we can reduce the false diagnosis. Diagnostic errors can be reduced by using care when measure for example, when take the test, when do the necessary measurement, when measure necessary or important things, repeating measurements by using the average to decrease the mistakes as can as possible. Research into the case of misleading laboratory test value and the laboratory must be good to can take trust results. Development of a new clinical test and better means developing this category to by spend more money and focus on this category to can produce a good or new uh, taste way and at the same time develop this category more to can increase the mistakes as can as possible. Like I said before, that's mean it's important category. By developing it, we can survive many patients' life. That's it. Our lecture today is done. I said before, it's too late. I know, but I didn't have another choice. Thank you about your listening, your watching. Have a good day and see you tomorrow.